What's up, everybody? Welcome back to the Make an Impact podcast with real stories, real people, and real impact. My name's Stephen Turnbull. I'm an entrepreneur, husband, and father on a mission to empower individuals to share their stories so they can make an impact on you. I'm super excited for you to listen to this episode. We had Dr. William LeCates, the president and CEO of the Mohawk Valley Health Systems. I think this was one of the first public opportunities for him to really just dive into who he is. 6 weeks in the role. Only 6 weeks in the role. We're super blessed and super happy that he took some time to us. We learned about who is Dr. LeCates, not really the role of MVHS. We talked about that, of course, but we really dove into his story and how he got to where he was today. Let's jump into Dr. LeCates, president and CEO of MVHS. All right, everybody, welcome back to another episode of the Make an Impact podcast. Super excited for today's episode to have Dr. William LeCates, president and CEO of Mohawk Valley Health Systems in today. How are you today, sir?
Great, Steve. Thanks for having me. Really appreciate it.
Appreciate you taking the time. You're a busy man now. What, 6 months into the new role?
No, only about 6 weeks into the new role. Yes. So, yeah, you got me right at the start. So
really cool. Really
pretty
cool.
recent in the new job.
Well, it's really cool that you take the time to join us. I really appreciate it.
I'm glad to be here.
And I wore my colors today.
Well, I really like the gear. It's really nice. That's nice MVHS gear. I should have worn mine, but
Nick Spooty, I have to give him a shout out. Just had to make sure that I knew that this wasn't the modern logo, so I'll have to work my way into getting
good
the
looking.
new one.
It's a good looking thing anyway there.
So
well done.
we want to just learn about you, learn about your story. I know there's a lot of cool backgrounds, but I'll just kind of let you start and then and tell us, who you are, and we'll go from there.
Sure. Yeah. So I guess I'll start from now backwards a little bit. Be the easiest way to go. So I've been in the CEO role at MVHS for now maybe 6 weeks, and about a year. And a little more than a year prior, I was in the chief operating officer role. So chief operating officer is really, how do you make things work? Like, how do you bring a lot of good things together and make them work for the patient's benefit, for the community's benefits? That's the COO role. People would often ask me, like, what is that COO job? That's it. It's bringing the process together and making things work. And then, so that was my last year and a half here in Utica and in the Mohawk Valley. Mm-hmm. Going back, so I'm a doctor. I'm an internal medicine doctor, and I'm a nephrologist. So that's kidney disease.
Okay.
So out of college, I took a couple years in Lower Manhattan actually, and I did economic research and some banking right out of college. I worked for the New York Federal Reserve Bank for a few years. Loved the people, but I really felt called to being a doctor and working with healthcare and being next to people on that one-on-one role. So I went to medical school, and then that's 4 years, and I did residency training. That's 3 years for internal medicine. I did a year as a chief resident, and then I did a couple years as a nephrology fellow. So it's a 10-year total time period in Baltimore. I was at Hopkins doing all that work. And really, really great place to be, really fun place to be. Baltimore as a city has a ton to offer. It has a character a little like Utica in some ways, like Baltimore struggles, and Baltimore has pride and high achievements. It has a vision for the future. So I enjoyed being in Baltimore and being with everybody there at Hopkins. And I really, really enjoyed, and I'm very grateful to my wife. We were married before I went to a medical school. We were married while I was working in New York, so right out of college. And we had 2 of our 3 kids while I was in Baltimore. We started our life there. So we had a home there. We really, really put down roots. Yeah. And I knew at the end of that 10 years, because it's a long time, that I wanted to be a good father, and I want to be a good spouse. I want to be a good husband and a good doctor. So doing all 3 of those things takes careful planning. Yeah, like you can't let it happen by accident. It doesn't happen by accident, and anybody knows that. You got to be deliberate and be a leader at that. Sure. So we moved up at that time to Otsego County, to Cooperstown. It was my first job as an attending doctor, and I worked for Bassett Medical Center there. And I did a lot of teaching, students and residents, and I did patient care there. And great people, I really liked it a lot. And I had a philosophy there, I still have it, where when somebody needs something that feels difficult or uncomfortable and they ask me, I say yes. So I said yes to a lot of jobs down there. I mean, one job after another. And I was totally honored and thrilled to do those jobs. So I started teaching the residents, became the residency program director down there. I did that for 6 or 7 years. Then I started working with the the doctors there, the broader medical staff, and worked on some of the same projects, so improving quality, safety, helping people use the systems well. And that was a medical director of the hospital. And then, in the system of a hospital, people started reporting to me, and they changed my title to a different title. And after a couple of years, they said, we need somebody to be the president of the hospital. So I said yes to that as well. I said yes, because that was my approach. And I'm completely honored to do it. Great people, wonderful presence at the bedside down there. Like you get, like anywhere, you get great people that come in to be nurses and doctors, and they do a fantastic job. And I did the president job down there for 4 years, and maybe more than you want to know. But at the meantime, our kids are kind of growing up. They're making their way in life, moving out. And I felt like I had 19 years there in Cooperstown, and I really thought it was a time to be broad and try something that would teach me new things. It would just teach me, what's a national look at healthcare? What's a global look at healthcare? And so I took a shift there. I took a fork in the road, and I went to New York City and worked for J.P. Morgan Chase for about 2.5 years. And J.P. Morgan is a very wonderfully resourced company, and they want to change healthcare. It's actually, people think it's only a financial services company. It's actually a healthcare company in some ways. 250,000 U.S. employees, another 150,000 globally. It's a lot of people, a lot of dependence with those employees, and a lot of healthcare. So Jamie Dimon is really committed to finding value in U.S. healthcare, meaning if you invest in healthcare, the outcomes get better. And that sounds obvious, but it's elusive and difficult. So I had a great 2.5 years working on some of those healthcare problems, and really learned a lot. Great people, wonderful learning experience for me. And also possibly more than you want to know, my living arrangements down there, where I had a 4th floor walk-up studio apartment without any laundry. And if you've tried to find housing in Manhattan, you know that this is about the standard. This is about what you get. Yeah. And my wife, who's just wonderful, we're married this summer 33 years, I think. After about 2 years, she was like, "Look, this is not a good arrangement. This is not a good situation." So I was thrilled to have the opportunity to come to Utica and to come to the Wynn Hospital and work with Darlene Stromstad, where I had the great, chance to be mentored by her for more than a year. Anyway, that's my long story.
So it was either at that point it was find a place with laundry, or we're going to Utica.
Yeah, maybe an elevator would be good too. I mean, or more than one room, like anything. But it was, it was sparse accommodations. But Manhattan has a lot to offer. New York City has a lot to offer. One of our kids is down there, so it's fun to hang out with our daughter down there. But
I want to take you back to something you said about leaving college and jumping into the finance world. And so was medicine and healthcare never really the plan if you were leaving college looking at that? I mean, what was the pivotal moment you said that you just said, I want to do something different where I'm helping people? And what was that moment for you?
Yeah, so my wife and I met in college. We both went to Amherst College in Western Massachusetts. And it's a liberal arts school, and there's not a core curriculum, not a required set of classes. So I took a lot of things there. I took some, math and science, and a lot of English, took some economics and some religion, and, whatever I wanted to take. And it was really wonderful. And I think the goal is to teach you how to think and read and write. And most of the other things you have to know in life professionally, you're going to learn them later. Yeah. And so I had taken a lot of science at Amherst, and a lot of economics and a lot of humanities, So when I got to the Fed, I really the economy worked with economists on some of the projects they were working on. You work as a junior person on advising people about economic data and projects, and we had a lot of time to just talk about what should a young person or a person advanced in their professional career, what's their role as a public advocate? Like, how do you contribute to a community or society? We talked about this idea of like the fabric of society. Really wonderful academic people at the Fed, but it led me to understand that, my gift was more likely to be at the bedside as a physician. And I was just drawn to that counseling, caring role more than I was thinking about like aggregate financial things. Yeah. Now, here I am back thinking about aggregate financial things a lot, as a CEO. So I know that this is important and critical and necessary, but I really, at my core, my training and my professional career has been as a bedside doc. And so that mindset as a bedside doctor is something that guides me very strongly in my CEO role. And I have wonderful people advising me who are expert to a high degree at things like financial modeling and,
Sure.
and stuff that I know about. I know enough about to ask questions and steer in the right direction.
Yeah.
But I can't substitute for some of the experts that are around me in these areas.
Yeah. Yeah. We're 25 episodes into the Make Impact podcast so far, and the theme that keeps coming up is finding a team and finding the right people for the right seats and the people to build around you to be able to do it. And I love that. Before I kind of get into that, I want to go back to, if you had to give some advice, so I did my homework, like I said, last night, and thank you for your service, by the way, too.
Appreciate that.
And maybe we'll touch on that in a little bit, but my initial reaction looking at your resume was, how am I going to fit this into our 40-minute conversation? Because it's impressive, all the things you've done, the different experiences and and I love that mentality you have of like when you were at Cooperstown of what's next and what's the next challenge? How can I, make a bigger impact in this sense? But if you're talking to somebody in their late 20s, early 30s, that's in that, same job and maybe just thinking, oh, what do I want out of a career? And what advice would you give them?
I'd say, you want to finish a day and find value. Like it's important to finish a day professionally. For me now, it's been for my whole career. You want to look back at even your day, one day, and say like, how did I create value today? Like what did I do today that made a difference for the organization or for the people we serve? And it can look very different. Like sometimes as I work, and I still do some patient care, which it's really important to me. It's it's a core aspect of who I am professionally. And sometimes the goodness I bring in a day might be a patient care encounter. And there's in no way would I diminish the importance of that. That's critical. It's core to what a healthcare organization is. But it might be that, I had an opportunity to work with someone who was troubled by a healthcare experience. It might be that I was able to set the tone for something moving forward that is strategically important and needs principles for guidance. You build a framework of principles about something.
Sure.
So occasionally, a young person, and I work with lots and lots of young people, I'm thrilled to do that. Occasionally, you'll see someone have a sort of a transactional mindset. Like, if I do this, will I have this? Like, if I do A, will I get rewarded with B? And I would say, advice is to set that aside and first create value. Like, first be a person who brings value to the place where you work or the people you're around. And not for necessarily self-gain directly, but for self-improvement and improvement of the organization. And you build that idea that you're someone who brings value to an organization or to people. And that leads to another thing, into another thing, into another thing. You just find yourself in places where your voice carries and you have an ability to influence something that might be important for a community or for a family or for people.
And around that topic of transition too, I'm curious to talk to you about your transition. And I know you said that you still do some patient care, but the primary focus is leadership and all those things that we talked about. So if I'm just thinking back of the timeline in Cooperstown when you said that yes again and took that president role, how was that for you as transitioning from primary focus on patient care to now the leadership?
Yeah, it was comfortable because I think, again, the decisions around where an organization goes should be decisions that are consistent with what our community would want and ask for and what our individual patient should want and ask for.
Yeah.
And I use that as a filter sometimes. So if we're working on a project or making a difficult decision and I pause and I say, if we asked our patients walking into the emergency department, would this be important to them? And they say, no way, we could care less about that. We really want you to, get us in quicker or make sure, we have a doctor at our bedside in fewer minutes, like right away. I mean, there's lots of things people care about. Now, often our projects and initiatives are 2 steps removed from those very immediate things, and that still has a lot of value. But if we can't tie our work back to what's meaningful to the patients in the community, it's a time to pause and say, hey, maybe we're off track. Maybe we need to get in touch with what our community needs and what our patients need. So being a doctor, which I continue to do as I was president of Bassett there, same as here, a little different role there because I'd practiced there for 20 years. Yeah. But I think it's grounding. It's sometimes therapeutic too.
Sure.
Like I mean, I'm sure it's true for both of you in your professional lives. You do something and you face some challenges, and sometimes it's good take a step to the right or left and do something a little different with different challenges, and it brings those different rewards, personal rewards.
Yeah.
So doing patient care for me has a therapeutic aspect. I'm grounded when I do it.
Yeah.
It gives problems context. So sometimes my administrative problems or challenges, they seem smaller if I've had an opportunity to work with people who are struggling through some tough illnesses.
Yeah. We talked a little bit and joked over how in Cooperstown you said you were always the yes man, like, yes, I'll do that. Yes, I'll do that. But for me, that shows just constantly seeking the opportunity. And we talked about the transitions you've had in your career that have led to where you are right now and those differences in those transitions. But what do you think in you is so advantageous to taking that opportunity and jumping into it and saying, yeah, I'm interested to do more and do more and do more?
It's partly necessity. So, I really, I'm driven by having a purpose. This was when I was young in training. I think I was my first year out of medical school. One of the cardiologists at Hopkins was teaching us this required, very mundane thing. And all of us as residents, we were really, familiar and casual with the cardiologist. And I remember his name was Dr. Brent Petty, who's a wonderful cardiologist. I remember saying, "Hey, Dr. Petty, how did you get this terrible job? Like, how did you get stuck teaching us this terrible thing?" And he goes, "It's important. And if I didn't step up and do this well, you wouldn't do it well, and we wouldn't serve our patients well." I mean, it was a very grounded answer, very mission focused answer. So again, you can't always be an exemplary person every day. Sometimes you finish a day and say, tomorrow is a new day. I'm gonna start again. But on average, if we can find that purpose in the things that we do, if I can find purpose in things I do, it helps to drive me along and motivate me. And I try to be meaningfully successful at the things we're doing.
Yeah, absolutely.
And things without that mission and purpose, now as the CEO, I can pause on those things and understand them better before we push a lot of resources into something that I don't fully understand yet.
Yeah. Now we're only 6 weeks in, so but I think something that's so cool is, like, as the leader of this big organization, you have been in those positions that you're helping lead. You started all the way from med school, worked your way up, and was still practicing. And there's so much value in being where these people were as far as your team, or still with your practicing. Talk to us of how you think that benefits the overall health system.
Well, I think it's both a benefit and a caution. The benefit is some things I can work through pretty quickly because I realize that the person at the bedside who's asking for an improvement or sometimes a piece of equipment, we worked on some of these things today, is right. And it's very clear and they're right. And we don't have to go through committees. I know when we have an urgency and we have to make a correction or replace something or, make an investment.
Right.
So that gives me a speed that without a clinical background, it would be hard to have that speed around things. The caution is that sometimes when you've done a whole bunch of things, you think you know how to do a whole bunch of things. Yeah. And you don't if you're not touching the work. So I'm pretty careful now because I have authority and I have some experience with a lot of things, but I'm very careful not to replace the knowledge of a person who's touching the work.
That's a great point. It's
tricky in a meeting. If I come in a meeting and I hear something and I have an opinion, sometimes the conversation stops and we're just done with it. And I work hard not to bring that opinion until the people who touch the work have had a chance to describe what they see as a solution, because that's key.
Yeah.
No way can I ever substitute for a bedside nurse or a patient care tech who's doing a very, very difficult job, in our hospital.
Sure.
Critically, really difficult job.
Yeah.
I need to hear from people that are in the midst of this, touching the patients. So, and partly I learned this from making mistakes. I've implemented solutions through partial knowledge and high authority, and they haven't always been good. And I can own that. And I realized, I said, that was a terrible solution. It was a terrible idea.
Yeah.
I've seen these things happen, and it's my fault. Mm-hmm. So I've learned over years to be pretty careful about avoiding application of authority when you don't have that full knowledge.
Yeah. Now, I want to get into everything MVHS, and we'll get there. But if you don't mind, talk to us about your service for the country, and thank you again for that.
I sure appreciate that. Yeah, I was my father served in the Army. His dad served in the Army. It's just part of being a person growing up in the United States. In my family, it was part of my mindset as a young person growing up. And again, my wife and I have been married a long time, and she gives me the best advice in my life. So I thought about this during medical school. I thought, hey, I'm going to be a doctor. I can, serve in the military. And you lose a lot of freedom in that time, which is a gift that people give. And she was pretty against it. We had children. You're moving around every couple of years. Same thing during residency. I said, Debbie, maybe this is the time. She's like, no, it is not the time for you. And then when we settled in Cooperstown, she said, she knows. I mean, she was with me and she's truly a saint. So she says, yes, this is the time. And so I joined the New York Army National Guard after we settled in Cooperstown. And it's a great, model for someone who has a home and children, the kids are in school. I have a profession. The hospital's very supportive. And I was able to join and really support medical care for soldiers in New York State on a weekend basis, a monthly, and through some training, usually in the summer for a few weeks here and there. And then it was a time where lots and lots of U.S. service members were overseas, a lot. And so as soon as I finished basic training, actually as soon as I was in basic training, and I got orders to go to Afghanistan right away. I mean, I got them as soon as I was going to become eligible. Those were my orders to go to Afghanistan. And I went back again then just a year and a half or 2 years later. I had a second tour in Afghanistan. And then I went to West Africa during Ebola, because the Army was the only way to get in and out of the country. I mean, there's no way to get out of Liberia, West Africa, during that pandemic because flights were stopped. Commercial flights in, commercial flights out were really very limited. So the military had the ability to put people into the country. So I did work there for 6 months during Ebola. Then I went to Iraq a couple of years later. Each of these very different professional experiences, some really phenomenal professional experiences. You have the opportunity to intervene and give care in a setting that is very different from U.S. healthcare. You have few resources. Sometimes that requires a lot more bedside clinical judgment than you'd have if you were using CT scanners and MRI scanners to help make choices. Yeah. So it was a challenging professional environment and a service environment. And the soldiers I had a chance to work with, just, very giving, wonderful people. So all around, I grew professionally through these experiences. And, I was pleased. It's my job, it's my duty to do that. So I did that.
Yeah.
And I'm still active in the New York Army National Guard. I was there last weekend. Nice very people, cool. And really you meet a cross section of New Yorkers.
Yeah. What do you think that military experience has taught you from a leadership standpoint?
A lot. So the leadership training in the military is very structured and deliberate, and they can do things that the civilian side can't do. You just cannot put people in physically demanding leadership training programs in the civilian world. It wouldn't be right.
Right.
But the military can do that. The Army can do that. So it starts at each level of your progression. You have, again, structured, kind of time-tested leadership programs where you're taught to have comfort stepping into that leadership role, whether it's a small group of people or as you progress, a larger group of people, and then as you progress further, and I've kind of progressed through these different areas, the strategic or the national level where you think about, what should the role of a nation be, and how should we work with other nations, and what are the structures in government that allow the military to be part of these plans. So I had a chance to attend the Army War College as part of this training. It's in Carlisle, Pennsylvania, and a lot of really high quality academic work. Actually, some of the hardest academic work that I do there are the Army is the hardest graders of any academic institution I've been part of. They're not afraid to give you a C, if you don't shine.
Yeah.
But really good training. So I think that kind of leadership training, which I've had for years and years, has helped me to set goals on the civilian side and to understand what our barriers are in reaching those goals and put a risk assessment around that. It's just the basics of strategic planning.
Yeah. I want to go back to something that just came to my mind from the research, and that was, and correct me if I'm wrong, but you were leading Bassett during COVID.
Yes. COVID, yeah.
Yeah, tell us about that.
Well, it takes every single person contributing. And so like here in the Mohawk Valley, everybody who goes into the bedside was doing so in a risky, uncertain, adverse environment. And early in COVID, of course, a lot of people in healthcare were dying because the exposures to healthy people were of a high level, and the virus at the time was virulent, so it brought a high mortality. So a dangerous, difficult time, and a lot of courageous people at Bassett and here in Utica, the Mohawk Valley, coming in to give health care and to make sure it was health care that saved lives. So that was something I was honored to be a part of. I had just a couple years before that been in this Ebola outbreak. And some of the principles of how you contain Ebola, well, we sort of pushed early on at Bassett. So we put up tents outside of the emergency departments throughout the Bassett Healthcare Network and outside the place. And people said, "What are you doing? Why are you guys putting up tents outside?" And those were triage tents. You can't bring somebody indoors right away if you think they have COVID. So, I think maybe even in the media, some people made fun of us and thought, this is just frivolous. But it turned out to be critically important.
Yeah.
We rented a lot of extra ventilators early on, so we had extra ventilators. And we collaborated across the region. I spent almost every day on a phone call with leaders across New York State, including with Dr. Hall, who's here. He was the chief medical officer here at Mohawk Valley at the time. He was on the call. B. Grouse, who led the hospital association, organized these calls. But I remember on Thanksgiving Day, I'm on a call with B. Grouse and Dr. Hall and a bunch of other people working through, COVID planning. Every day, hospital systems collaborated. And we moved patients to where systems had ICU capacity. I got my first COVID vaccine right up here at the St. Luke's Hospital because the systems collaborated, really. So it brought out a lot of good in people in a very adverse time.
Yeah, absolutely. So I want to get into MVHS, but before that, quick caveat. Talk to us about Utica and your experience of moving up here. So was it because it was Cooperstown, then Manhattan, and then back up here was the first time you lived here?
Now, we did keep a home in Cooperstown where we raised our kids.
Okay.
And the kids are, very tied to coming home to that location. So they have that. And then my wife and I, we have a home up here in South Utica, and I love being up here in South Utica as well. This was really not an unfamiliar area to us at all. My wife, Debbie, she coached swimming with the Clinton Cudas ever since my little son when she started coaching, he had to ride in a pack on her back while she coached on the pool deck. And 2 weeks ago, we went and watched him at one of his college swim meets. He's a college senior, cool. Swimming. So, I mean, I can't even put the years together. And both of our girls swam also with the Cudas for different times. And Andre Parody was the coach with Debbie. And so Debbie and Andre, coached the Cudas for years and years and years. So she made the drive up here to Clinton forever. And I spent a lot of time, not nearly as much as she did, up here on the pool deck watching the meets and got to know lots of great people from across Utica and New Hartford and from Clinton.
Very cool.
And so we felt really tied into this community and have people that, we consider close friends up here. So it felt very comfortable to me, the extension of, Otsego County into Oneida County and Herkimer County. And it feels like these regions, you can't tell the difference when you drive from Otsego County into Herkimer or Oneida County. I mean, it's one large community. And so in that way, it felt very comfortable. And then when I came up to be the COO and now in the CEO role, across the board, people have been welcoming to me. Local businesses, families in the region, really other healthcare organizations. I felt really welcomed. The educational organizations, I've tried to get out and meet folks. Really welcoming, collaborative. And we have a common purpose and a common mission. I mean, just about everybody. Mm-hmm. So I think it's been it couldn't be a better welcome, and it's very comfortable.
Yeah, well, it's cool. It's cool to hear you say that because Mike and I both born and raised here. You went out for a little bit and brought them back in, but you can hear people that were born and raised here, start businesses here, start families and careers here, say how great it is. But to hear people,
it's really
that have been experiencing all over the place.
It's a great area.
Yeah,
and we love love to eat up here, and so it's all the aspects of Utica that can be undiscovered, you discover them pretty quickly.
Sure.
So.
And one of the great new things that's been going on in Utica is the Wynn Hospital, right? And so that's a lot of excitement. Tell us what's going on with that. Talk to us about just MVHS.
Yeah, sure, absolutely. So we, Darlene Stromstead, who led for years, led something that was super difficult. I mean, merging two hospitals, merging the medical staffs, the employees. Yeah. There's an electronic record keeping system, the electronic medical record. Ours is called Epic. That's the one used around the area. It's how patient care is done. So it's very high stakes, expensive, risky. That got implemented at the same time this whole merger was taking place.
Yeah.
And then to construct a new hospital building. I mean, it's hard enough to construct something modest. I mean,
Sure.
it's like a parking lot even can be difficult. I mean, to get a hospital built in upstate New York, it is a rarity. And I know there's some history about it's the only one in so many years.
Yeah.
Well, there's a reason for that. I mean, it's really, really, really difficult to get the funding. So this was built through generosity. It's generosity of folks in New York State, taxpayers in New York State, donors in Utica gave unbelievably generously to help this hospital be built. Steve Wynn, the Wynn family, gave a lot of money to help the hospital be built as well. So the success here is a public success, a public celebration, the success of this Wynn hospital. So that's where Darlene was perfect, really perfect. You couldn't have found somebody with more experience as Darlene. So she was super. Now, like what's going on at Wynn Hospital, my duty is that we have to use this facility and all our facilities across the region. I mean, we're spread way geographically in a very broad area. We have to use these facilities to benefit people. That means we have to give the highest quality health care, and we have to grow in areas where there are unmet needs. And there's a lot of unmet needs across Utica and the Mohawk Valley. So our duty, as I see it, is to be we're a public trust organization that's quality, safety, and we're an organization that has to grow to meet unmet community needs. It's an underserved area, so we're intending to do both those things. So many of our highest priorities fall into those categories.
Sure. What is some top priorities? I'm sure the list may be long in the new role of just kind of looking at what can we do to be better, but what are those top priorities to share with the community? What's ahead for you?
I would say as someone crosses into the hospital, like you cross into our hospital or any of our clinics, I've been very clear to say that quality, which is deliberate programs around understanding data. Like you have to understand your performance in quality. You have to understand national standards, what's expected, and we have to know what the best practices are to close the gap. That's quality. So we're implementing quality programs, just a different way of thinking about quality across the organization. Safety means you come into our care and we don't hurt you. Now you would think, well, how could somebody be hurt in a hospital? A lot of ways. Infections, falls, sometimes there's skin breakdown, that's a pressure injury. These are all things that are preventable and we have to prevent them. So our duty is to prevent them. It's a system of safety. And then there's this category of patient experience. People get surveys when they leave our hospital. They're nationally managed surveys. Those are important. It means how did somebody feel when they came into care? Like, did we listen to them? Did we make eye contact with them? Did we really attend to the things that were important to them as individuals or as families? Those are all three of those things are different. So that's one area where we're working on things. The other is, in terms of priorities that are tangible, is access, meaning we have capabilities because we have a lot of capabilities. Do we use those capabilities to benefit people? So if you move to Utica or Mohawk Valley and you need a new primary care doctor and you call up MVHS, do we say yes? Our primary care teams are nurses, doctors, advanced practice clinicians across the region, really, really hardworking, very high quality, wonderful people. Sometimes our systems work against us. We don't figure out how to get the person who needs care together with a place in this big system where that care exists. Mm-hmm. So we have to make that better. We're working on projects to improve that in medical terms, that's access. And then I know we have to grow. We can't even say yes to everyone because we need more primary care in this region. The country needs it. But we're working very hard to educate primary care docs. So we have a residency program. And then to hang on to them, to hire people that have put down roots in Utica and bring them on as primary care docs and grow our practices so we can care for people who need care. So that's the simplest growth is primary care growth.
Sure.
And then I know, too, that we need specialty growth as well. And so there's lots of specialty areas where more doctors would help meet needs that are currently unmet. And then a theme I have, and I hope you hear me say this just in the same way every time, is that this is a healthcare shortage region, and there's no room for competition. We're here to collaborate with people. I mean, I just don't see the purpose of competition where there aren't enough healthcare systems, there's not enough doctors. So my purpose is to collaborate with any other system in the area, groups of doctors, lots of wonderful community organizations doing great work. We want to support them, collaborate with them, and just help them.
That's
so
great.
I'm trying to do that. Trying to do that at every opportunity.
I got two more questions for you.
I'm with you.
I respect your time here. As the leadership position that you're in, for anybody that's watching this, what would you say is like one non-negotiable for you to have a very successful day? I mean, because I was going to ask you the question of what's like the day in the life look like, but I can imagine it's all over the place.
It's pretty wide ranging.
But like, what if you think of like, what's the one thing that I got to do to have a successful day? And we talked about having, the impact and all of that, but like, is it the workout in the morning? Is it the getting my day prepared in this half hour? Like, what, for any young leaders that are out there, leaders in general that are watching this, like what would something be that's worked well for you that they could take away?
Well, I will say, I believe that meaningful presence makes a difference. So I do try to show up places where people are caring for patients, where my executive team is working. I try to be present next to people and available. I listen. I want to see the work and hear the work. That has put a strain on my exercise routine because meaningful presence starts at it starts at like 7 in the morning and it goes till 8 o'clock at night. So I do have to get my feet on the ground in terms of something that's really important, which is just self-care. And, a little bit of exercise, good night's sleep, all that.
Yeah.
So I probably shouldn't be a model of that for your young people out there.
Well,
yet.
Fair, it's only 6 weeks in.
I'm getting there. I know it's important. I'm gonna find my grounding. To me, for years, I mean, the newspaper that's down in Oneonta, I'll say it's the Oneonta Daily Star, and here we have different. But in Oneonta, and so for years at Bassett, I worked with a CEO there, Dr. Bill Streck, and Bill is just a great healthcare leader, good guy. He's retired and active locally, really superstar. But he used to say, there's this Daily Star test, meaning if you're talking about something and you'd be embarrassed to read about it in tomorrow's Daily Star, we shouldn't be talking about it. And I try to have that same principle. So a good day for me, and I really don't deviate from this. I'm not talking about a program. I'm not talking about people that I wouldn't be proud to talk about publicly. Now, we make difficult decisions sometimes.
Sure.
They're not always easy decisions, and I'll make decisions, and I do, that are not universally popular because they're difficult sometimes. But they're ones that I hope have fairness to them, and they're principled, and I hope they honor the people who need to come in for care, and they honor our employees. And I'll try to, there's a trust issue. People have to trust me to make those decisions. But I won't have conversations. I won't talk about people derisively. I mean, I'm going to talk about people in a way that honors them. So that's not a super hard principle to hang on to. Each of you probably has that as well.
Sure.
But you got to hang on to it, and you got to hold everybody to that standard. So I do try to honor that idea that, look, if this weren't confidential and we talked about it publicly, we'd stand behind it.
Love that. I'm going to go back. Last question.
Okay.
I'm going to go back to something that you said that was just stood out to me, and said early on you realized it was difficult to be a great father, a great husband, and a great doctor.
Yes.
Talk to us real quickly, if you can, on kind of what you meant by that and what you've learned through your career about that.
Yeah. Sometimes being a busy doctor and being a great doctor can be two different things. In other words, sometimes that you have to pause and be there at the bedside in a way that's unpredictable and difficult to schedule. You know that you have to be there, and you have to be there. And you can't turn away from that. You cannot turn away from that patient, that person who needs you in the bed. Now, if you have a practice that's built around that expectation that you have support, you have partners you trust, you have the ability to say, well, this Saturday, my trusted partner's there watching the shop. They're in the hospital. They're taking care of these folks, and you trust them. That's a way where you can step aside and be present on that day with your family, and you can be there for a child's school assembly or something. Now, can't always be at every school assembly, but you can be sometimes present and set expectations for when you can be present. It's possible for a person just entering medical practice to enter into a practice that really doesn't allow that kind of stepping aside. And this can build wonderfully dedicated doctors, sometimes at the detriment of that ability to be present where you need to be present.
Yeah.
So you might make trade-offs. Sometimes it's pay, sometimes it's prestige, sometimes it's academic success.
Sure.
But I think setting those priorities of how you're going to be present for your family on average, because some days you can't predict what's going to happen.
Yeah.
But on average, setting those priorities is possible for individuals who enter healthcare if the decisions are made deliberately and carefully with that as a highest consideration. So I'm a little cautious because it's easy for me to say this retrospectively.
Sure.
Right? I can look back and say, well, it turned out the right way. And I know people who are in the middle of it right now could listen to this and say, well, look, I'm really busy and I wish I had more time.
Yeah.
And it's hard to carve it out.
Yeah.
But for me, as a young person just starting out, I was pretty careful about it.
Yeah. Well, I think the biggest, and Mike and I talk about this in our entrepreneur journey, I think the biggest thing with that is awareness.
Yeah.
And you hit on that. I can't thank you enough for taking the time. I really appreciate this conversation. Thank you so much.
Really fun to be here with you.
I know you're really busy.
Thanks for listening to me. I usually don't. I mean, it's more and more the role where I end up talking about myself.
Yeah. No.
I'd love to come back and talk about you. I'll interview you.
I don't know if you want that. We're going to need more than 40 minutes.
Well,
but
it'd be good for the community.
It was great to learn you and introduce you to the community in this new role. And I just appreciate it. Sounds like every MVHS is in great hands. And
appreciate it.
And I've heard that already in 6 weeks. And so I'm just really thankful for you to take the time. Everybody, that's another episode of the Make an Impact podcast. Until next time, go out there, lead with purpose, and make an impact in someone's life today, even if that's your own. My name's Stephen Turnbull. We'll see you next week. Take care.